my name is Leilani Chagas. I'm a physiotherapist, and in this video I'm going to show you how to flexibilize or work with the muscles that are in front of your neck. We call the jaw muscles or the hyoid muscles. So hyoid is a bone that's here in the front of the throat, and we have several muscles that attach from the jaw to that bone, and then from that bone to the chest bone or towards the shoulder blade. And there are some muscles that comes from that bone that fixes into the back of the skull. These muscles, they work to open your jaw and also to allow your neck or your head to move in all directions and hold your head from falling backwards. So if you're having a force that goes with your head, or just the weight of your head falls into gravity line, they are the ones that will help to keep it forward or keep in position. They also have a function as a bridle of the horse, because they are like cords that allow to drive the head into different directions. And they are most to blame, especially in case when clients had whiplash or just contusion to the head that cause severe neck pain or spasm. They will always be tense, and then they may block the neck and the head into a forward head position. So they are to blame as well for that position, not just weakness in the back of the muscles. So if we try to have someone with a forward head position just going through range of motion without managing those muscles, we can create too much tension in other areas. So if you're struggling with a forward head position, or you're struggling with tension in your neck and you're having difficulty to turn or to bend backwards, it's good practice that you release the tension in the muscles in the front of your throat, your jaw, and then on your chest as well. So to do that, we are going to be doing an exercise. It's very important that you splint your rib cage here, the top of your rib cage, with the palm of your hands, and put a down pressure there. If you don't do that, you're going to see what happens when I turn my head back, and without support it falls off. So you're not going to have as good support of your hands, and you may be overwhelmed with the tension in the back of the skull. So keep the chest down by splinting with your hands. It's important that you position your jaw in a good direction, because if you don't lock your jaw, you may have a deviation there that may overstretch or just stress the jaw joint. So you want to keep the pressure. Put the tongue on the roof of your mouth. So just place the tongue in the roof of your mouth, and then just close your teeth. And when you're done with that, you can just turn your head back. And when you do, try to look up. And for the extra kick, you're going to try to exhale. So position, go as far as you can, and exhale. And feel the stretch in the anterior parts there. So you should feel a good stretch of your muscles in the throat there, or even the ones that attach to the base of the ear there. So what you want to do, and you can progress the stretching by just doing the backward movements of your neck and head, and then you can add lateral rotation as well. To stretch more to the sides of the neck. So the number of repetitions will be 1 cycle of breath. Return, allow yourself to swallow. You don't want to be swallowing while your head is back. It can create a big tension or spasm in your neck muscles. So breathe out. Return back and swallow. Keeping in mind that you need to keep your jaw closed, the tongue in the roof of your mouth. And then you may add any direction you want. Go and search for where you feel the most tension, as if you're trying to look at an airplane in the sky. Stop where the tension is and work through it on that deep exhale by keeping that chest blinked down. If you are a person who has difficulties when you're lying down, you have difficulty in swallowing, since you started with the neck pain, or you're feeling too much tension around your throat, or you feel like a lump in your throat when you swallow, or when you just lie down, it's possible, it's good to have it checked, but it's also possible that's because you have tension over the throat muscles here that guides your throat and your jaw. So it's important that you stretch them in full length with the neck straight. And to add an extra kick, a level, if you bring your tongue forward, you are going to position your tongue in a higher position, and that will allow a deeper stretching of those muscles. So the stretching will look like this. Bend down, stick your tongue out, retract the tongue and bring your head back. In that way, you may feel a deeper stretching coming from the back of your mouth, tongue, and deeper stretching in your jaw. If you suffer from jaw problems as well, that's likely that you're going to feel tension. So it's important, if you're trying to deal with a forward head and you want to get more mobility but you're feeling tension in the front, it's good practice to stretch the jaw muscles. Also, if you are having headaches and then you have difficulty in moving the position of your head there towards the back, or if you're having a hard time to flex your head, you can do the same stretching by bringing your chest down, bending your head, not neck, just the head, and then just bringing your neck down in a flexion mode. That should stretch one specific muscle in the jaw that connects to the back of the skull. It's called the stylohyoid muscle. So this is just a few tips to add onto your neck exercise routine, and then to just try to relax not just the muscles that are in the side and the back of the muscles, but in the front. And be very mindful to do the relaxing way. Or if you don't do the right support and you end up by overextending your neck, you're likely to be sore on your neck or on your head, having a headache if you overdo that. So if you're doing, just review if there are any other ways you can modify, especially by using the breathing, the positioning of the chest, and that initial growing taller or bringing the neck in a neutral position fashion. That should avoid you having any complications. Thank you.